Good day everyone, my name is Jessamine Tubiano and today I'm going to discuss the interventions for children with exceptionalities. The first few years of child's life is important for the promotion of his or her healthy physical, emotional, social, and intellectual development. Some scholars call it the formative years, while others call it the windows of opportunity. Whatever the term used to describe the crucial years in child's life, what is central to the idea is the fact that parents, educators, policymakers, professionals, and even the general public not just recognize but also invest in the child's first 8 years of life. This goes both for the typically developing children as well as for the children with exceptionalities. Exceptional children vary in the degree of help and support they need. Some children need help and support physically, while others need help in their speech. This lesson will briefly discuss some of the common intervention and approaches that parents and educators can do to help and support children with exceptional needs. Early intervention. When we talk about the delivery of a coordinated and comprehensive set of specialized support and services to infants birth to age 2 with developmental delays or in at-risk conditions, we are referring to early intervention. What is early intervention? Early intervention is the means of providing developmental service to children with disability in order to change the long-term effect associated with the disability. Early identification of developmental delays and well-timed early intervention can alter a child's long-term consequences of a disability. The aim of early intervention has evolved over the years, but in all those changes, it can still pinpoint to the fact that its purpose is to affect the overall development of the child in a positive way. Several researchers have stated the importance of early intervention for young children with disability or children at risk. Identified themes are as follows. Early environmental stimulation can positively facilitate succeeding development and readiness for learning. Intervention during the critical period in a child's life is vitally important if we want young children to acquire more complex skills and competencies later on. It can be assumed that the impact of disabling conditions such as severe hearing loss on speech and language development can be minimized and can possibly prevent secondary disabilities. Early intervention programs can improve learning deficits and problems frequently attributed to certain risk factors such as environmental conditions. Families of young children with exceptionalities can improve from accumulated benefits provided by early intervention programs. It is also cost-effective. It can reduce the amount of other services that child need to receive at an older age. Timely provision of intervention just show that it can improve the outcome of children with disabilities by preventing developmental delays. Now let's move on to occupational therapy. Many children with special needs are referred to occupational therapists to help them with areas they find difficult to do. What exactly is occupational therapy or OT, and how do children benefit from it? According to American Occupational Therapy Association or AOTA, they define occupational therapy as the therapeutic use of everyday life activities or occupation with individuals or group of the purpose of enhancing and enabling participation in roles, habits, and routines in home, school, workplace, and community. Persons with disability and non-disability needs are referred to occupational therapy session for habilitation, rehabilitation, and promotion of their overall health and wellness. Those who are at risk for developing an illness, injury, disease, disorder, condition, impairment, disability, activity limitation, or participation restriction are given service. So occupational therapy is guided by the following principles. First is occupation. It is a daily life activity that are meaningful and purposeful in which people engage in. This may include self-care, rest, sleep, play, social participation, and education. Next is participation. Occupational therapy service enforce the child's and family's meaningful participation in occupation. Next is family-centered. The family identifies the priorities of the intervention because they know their children best, and it recognizes the fact that optimal development occurs within a supportive family and community environment. Next is family capacity and resources. Occupational therapy practitioners uphold and respect the capacity and resources of each family. Natural environment. Services should be provided within a family or community setting because occupational therapy practitioners recognize that there is an interrelationship between the context and environment that affects participation and performance. Next is family routines and rituals. Occupational therapy practitioners encourage children and their families to participate in everyday activities and occupations. Culturally sensitive. The OT personnel is sensitive to the culture in which the children and their families belong to, and such culture influence their occupations. Evidence-based. There are supporting pieces of evidence that show the effectiveness of OT in the treatment plans of children and families. Spiritually, which is working hand in hand with mind and body, is vital to occupational therapy as it expresses itself in the way of doing things and why and how individuals do things. According to Wilson 2010, the mind, body, spirit of an individual is highly associated with everyday activities. Now let's move on to speech and language therapy. Developmental pediatrician may recommend parents of children who have communication, eating, drinking, and swallowing difficulties to receive speech and language therapy. Speech and language therapists, or SLT, can help treat, support, care, and assess children with these problems so that they can communicate better. SLTs work closely with clients, career, teachers, and other health professionals to develop individualized program. Infants who have cerebral palsy, cleft palate, and Down syndrome can benefit from speech and language therapy. Children who have difficulties in primary speech, language, and communication can also receive intervention from speech and language therapy. Next is physical therapy. Sometimes children with exceptionalities need help and support in their movement, motor development, and body function. This is where physical therapy comes into place. The therapist called physical therapists, or PTS, work with children and their parents so that each child will reach his or her maximum potential. Their aim is to assess these children so that they can function independently and actively participate in home, school, and community environment. PTs also work collaboratively with members of the family and the community and specialists in areas of education, development, and rehabilitation. Children with exceptional needs may benefit from the following service to name a few: movement and mobility, balance and coordination, recreation, play and leisure, daily care activities and routines, strengthening, developmental activities, and pain management. Music therapy. According to the American Music Therapy Association 2018, music therapy, or MT, is a systematic process of intervention wherein the therapists help the clients to promote health using music experience and the relationship that develop through them as dynamic force of change. Music is used as a means to deal with the clients, adults or children, emotional, cognitive, and social needs by creating music, singing, listening, or moving to music. Sten et al. 2015, Stigman and Gerrit Serger 2014 enumerated four main methods used by music therapists during session. They are as follows. First is improvising. Creation of music by means of the voice, body, or simple musical instruments. Listening aims to activate and relax the clients, evoke specific body's responses, memories, and fantasies, and stimulate self-knowledge and reflection. Next is recreating. Utilize recompose pre-composed music that the clients learn to play or sing. Next is composing. Help the client to create music such as instrumental pieces, lyrics, and songs. Music is one of the human communication that may target different problems such as movement, sensing, and feelings. Music therapy does not require one to be inclined to music but requires engagement with the music. According to et al. 2019, music therapy may help children who have handicap physically, intellectually, or emotionally by having a positive effect on the psychological, physical, cognitive, or social functioning of children. In fact, music therapy may address some problems of children with autism, spectrum disorder, and other forms of disabilities. Art therapy is the therapeutic use of art making within a professional relationship by people who experience illness, trauma, or challenges in living, and by people who seek personal development. Through creating art and reflecting on the art products and process, people can increase awareness of self and others, cope with symptoms, stress, and traumatic experience, enhance cognitive abilities, and enjoy the life-affirming pleasure of making art. Art therapy addresses various clients' concerns. For some, AT helps them share and explore an emotion difficulty by creating image and talking about them. For others, it can simply be helping children hold a crayon or use a paintbrush. Just like MT, adults and children do not need to have a background knowledge in visual arts to be able to experience its benefits. What is important in AT is the client's expression of feelings and experience through art as a medium. During an AT session, clients normally use visual arts activities such as painting, drawing, and sculpting. Both the process of creating art and the finished project are important in AT sessions. How would AT benefit children with exceptionalities? In the words we live in, self-expression by oral communication is typical. However, not all experiences can be translated into verbal language. Some people cannot find appropriate words, while others really have difficulty expressing themselves. Children with various conditions, such as those with LD and even ASD, can benefit from AT. Usually, art therapists help their clients express feelings, gain a better understanding of their difficulties, and maintain or improve their quality of life. Next is play therapy. The Association of Play Therapy 1977 defined play therapy as the systematic use of theoretical model to establish an interpersonal process wherein trained play therapists use the therapeutic power of play to help clients prevent or resolve psychosocial difficulties to achieve optimal growth and development. Play has therapeutic power, and this facilitate and positively influence the kind of change that is needed in the clients. A child, for instance. This simply means that when a child engages in therapeutic play, the goal is to create change in his or her feelings, thoughts, and behaviors. This is an essential ingredient in play therapy. Child-centered play therapy, or CCP, is one form of play therapy that is based on innate ability of the child to work towards his or her own growth, maturity, and be self-directing. The therapist's goal is to create a warm, caring, and accepting environment where children can express and play through any of their concerns. Children are given freedom to direct their play in a way that they desire. Rogers 1980 proposed 3 core conditions for the conduct of CCPT. First is congruence between the therapist and the client, unconditional positive regard towards the client, and empathy with the client. Lastly is bibliotherapy. Alex 1993, as cited in Forgan 2002, defined bibliotherapy as the use of books to help people solve problems. Sullivan and Strang 2002 and 2003 define it as a child reading about a character who successfully resolved a problem similar to the one the child is experiencing. This method is used by different professionals working with adults and children to help them deal with their complex emotions in everyday situations. This method is very useful for educators because it only requires an appropriate book or story, a well-developed lesson plan, a reinforcing activity, and a suitable environment. Alex 1993, as cited in Forgan 2002, enumerated 9 benefits of bibliotherapy. These are as follows. First is awareness that others have faced similar problems. Second is the knowledge that alternative solutions to problems exist. Third, the development of a freedom to talk about problems. Fourth, the growth of problem-solving skills. Fifth, the further development of a positive self-concept. Six, relief of emotions or mental stress. Seven, the development of honesty in self-image. 8. The growth of interest beyond just the self. Lastly, the fostering of a better understanding of human behaviors. The success in using bibliotherapy as a form of intervention can be seen when children have made a connection with the story and exhibit positive change in their emotional health. When these children are able to successfully deal with their socio-emotional issues when the use of bibliotherapy is beneficial.